Welcome to the Get Fit Guys, quick and dirty tips to slim down and shape up. My name is Ben Greenfield, and I'm the Get Fit Guy. Now, the word cryotherapy may sound like something out of a science fiction novel, but it's actually something you've done before. If you've ever iced a sore ankle, taken a plunge into a cold shower or bath, or shoved your hand into ice water after touching a hot stove, it's simply the use of ice or cold as therapy. Of course, you can get very scientific with cryotherapy if you would like. For example, a few months ago, when I was at a health and fitness conference, I actually tried a pretty advanced form of cryotherapy in which my body was immersed in a sub-zero temperature chamber for 3 minutes. And if you care to watch the 3-part video series from that chilling experience, I'll link to it in the show notes for this episode over at quickanddirtytips.com. Now, in this case, the immersion in the cold was meant to boost my metabolism, assist with fat burning, and improve sleep. But in today's episode, we're going to focus on perhaps the most convenient, useful, and slightly more pleasant form of cryotherapy, icing sore muscles. And you're going to learn whether icing muscles really works for soreness, along with the very best way to ice. So, back to icing for recovery. In the episode How to Recover After a Workout, you learn about using techniques like nutrition, hydration, compression, blood flow, and topical ointments to limit the annoying muscle soreness that you often experience when you're lifting weights or running or exposing your muscles to potentially damaging activities. But icing and cold exposure are also among the sore muscle recoveries I personally use on a regular basis. On my blog at bengreenfieldfitness.com, I've written pretty comprehensively about the advantages of something called cold thermogenesis, including the multitude of performance benefits that you get from frequent exposure to cold temperatures and cryotherapy like cold water immersion, cold showers, cold hot contrast showers, or even the use of body cooling gear like a cool fat burner vest or this compression gear made by a company called 110% that lets you put ice sleeves into the gear. Well, the benefits of all these cooling techniques include enhanced immune system, increased cell longevity, decreased levels of inflammatory molecules, and of course, decreased soreness. The application of cold to a sore muscle is really not a new concept. The Greek physician Hippocrates wrote about the use of cold therapy to control pain and swelling in the 4th century BC, and the Roman physician Galen described the use of cold compresses for pain management following soft tissue injuries in the 1st century AD. I love to think about ancient Roman soldiers running around with cold and frozen peas and corn attached to their legs and arms. Well, during the Middle Ages, ice was used for pre-surgical anesthesia, and ice therapy has been extensively used in athletic training facilities and physical therapy clinics for the treatment of sports injuries for many years. But despite the seeming widespread acceptance of tossing a bag of ice or frozen vegetables on an injured ankle or aching shoulder, there is lately a sudden doubting of icing's efficacy across the internet and in several magazines. And the argument goes something like this. When an injury occurs, your body creates inflammation as a healing response. So, if inflammation is the body's natural way to heal an injury, why would you want to block that inflammatory process with ice? Well, it's also been claimed that icing may increase the permeability of lymphatic vessels. These are tubes in your body that help to carry excess tissue fluids back into your cardiovascular system for removal. Now, once that lymphatic permeability increases, there could actually be a risk of a lot of fluid backflowing into your sore or injured area, and that could cause more swelling than if you didn't ice in the first place. And of course, there are several studies that are commonly cited in this argument against icing. I'll link to all those studies in the show notes, but basically what it comes down to is that the studies demonstrate that your lymph vessel permeability does actually increase with icing, but within 25 minutes after you finish icing, the permeability returns to exactly where it was before you iced. Also, in any studies that have shown ice to not be efficacious, ice was used all by itself, with no compression, or pressure, and no elevation, which are 2 other injury prevention protocols that are highly recommended to be combined with ice in most sports medicine instructions. So the majority of studies that combine ice with compression and elevation do not show that lymphatic permeability increases and do not show that there's excessive swelling or lack of treatment from ice. And this is because the compression from pressure placed on an injured area actually reduces swelling and prevents fluid from leaking out of your vessels. Other studies that are commonly cited in the argument against icing, such as the article linked to in the show notes called Is Ice Right?, cites a bunch of studies that actually, once again, only have icing being done all by itself and actually are very small studies primarily done on animals. None of these results justify tossing your ice bags in the trash bag, but simply suggest that icing by itself may not work in some cases. Now, what we've learned is that icing sometimes works and sometimes doesn't. And the times that icing doesn't work is when you ice for very long periods of time, or you ice without using pressure or elevating the area that you're icing. Now, one of the reasons that you get so sore after workout is from swelling and the pressure placed on nerves and tissues from that swelling. Prevention of excessive swelling is important because fluid that escapes into tissues from excessive swelling creates a low oxygen environment that can lead to more tissue damage and delay healing. It's kind of a vicious cycle. In addition, that swelling can cause pressure against nervous system components called mechanoreceptors, which can also increase pain and increase soreness. But the benefits of icing don't stop with the ability to control this type of excessive swelling. For example, the cold temperature of ice can slow down what's called nerve conduction velocity, and that shuts down the activation of protective muscle reflexes, which makes ice a highly effective pain reliever and a muscle relaxant. If a muscle is in less pain and it's more relaxed, then mobilization and movement become a reality, and you can get back to the next workout more quickly. Ice also reduces metabolic activity in the tissues that are iced, making them better able to resist the damaging effects from that loss of oxygen from inflammatory swelling. In other words, when your tissue temperatures are low, that means less oxygen is required by those muscles to sustain normal, healthy metabolism. Now, when you ice, you also get what's called a hunting reflex, where your vessels pump all of the inflammatory and metabolic byproducts out of an injured area, while allowing white blood cells to rush in to speed up healing and reduce soreness. And when combined with pressure and elevation, this pumping action of ice can be an extremely effective recovery and soreness management tool. So, you now know a lot of stuff, but how should you actually ice those sore muscles? Well, if you have an actual injury, you should ice as soon as possible after the injury, for about 20 to 30 minutes, using frozen ice cups, ice baths, crushed ice, frozen vegetables in a plastic bag, or one of my latest finds that I'll link to in the show notes, a convenient pack of frozen peas. And those are not actual frozen peas that you buy at the grocery store, but just an icing product called frozen peas. Now, for overall muscle soreness that isn't caused by an injury, ice immersion works much better because you get that pressure from the water, and it can be accomplished by spending 15 to 20 minutes in a cold bath. Don't worry, it doesn't have to be teeth-grittingly cold. 55 degrees is just fine. Or by taking a cold shower. By doing that, you'll get all the other benefits of cold thermogenesis that I talked about earlier in this episode. Now, finally, if you want to combine compression and elevation and cold all at once, get some compression tights and put your feet up and put some ice into those compression tights. Like I mentioned, there are even some out there like 110% compression that come with little ice packs that you can put straight into the compression gear. Now, I'll put a link to all of this stuff in the show notes because I know that it does get a little bit geeky. And as a matter of fact, the show notes for this particular episode are even more comprehensive when it comes to icing. I list even more studies and go into all this stuff in a little bit more detail. So if you like to read, head over to quickanddirtytips.com. And if you have more questions about icing sore muscles, then go to facebook.com/getfitguy and ask your questions there. Until next time, I'm Ben Greenfield, the Get Fit Guy, asking you, what are you waiting for? Go get fit.